Welcome to The Explainer. Today, we're jumping into a therapy that's got everyone talking, from celebrities like Jennifer Aniston to top athletes, but it's also at the center of this huge battle with regulators. Okay, so a claim like that's pretty bold. It immediately lets you know this isn't just another health trend we're talking about. This quote frames the whole thing as a real conflict, a fight over access to something that, according to some, regulators might be trying to keep under wraps. So, what exactly are these peptides that have celebrities, athletes, and even doctors fighting for them? And why are they causing such a stir? Let's break it all down. All right, first things first. Before we dive headfirst into the controversy, we've got to understand what we're actually talking about. What is a peptide anyway? So, in the simplest terms, think of peptides as tiny little proteins. They're these short chains of amino acids, and their main job is to act like messengers in your body. They're the ones telling your cells what to do, everything from healing and hormone regulation to just basic communication. They're absolutely crucial.
And this analogy we found really helps it all make sense. Okay, so if you think of amino acids as individual letters of the alphabet, and big proteins as these long, complex instruction manuals, then peptides, they're like Post-it notes. They don't give the whole story, just a quick, direct command to your cells. Heal this, grow here, or do this right now. Super specific. Okay, so if these things are the body's messengers, what are they telling our cells that has so many people excited? Well, it turns out the list of potential benefits is huge, and this is really the core of why they've become so popular. I mean, just look at this list. The sources we looked at point to this huge range of potential uses. We're talking about speeding up recovery from injuries for athletes, helping with chronic gut problems and autoimmune issues, and even things like anti-aging, better sleep, and fat loss. It covers a lot of ground. And here's a really powerful example of how they're used. You've got this combo, BPC 157 and TB 500. BPC 157 is all about promoting regeneration of tissues, muscles, tendons, even the gut. Then TB 500 comes in and acts like a GPS, basically telling all the healing stuff exactly where to go. Dr. Josh Axe actually says this exact combination helped him recover from a really serious spinal injury, one that doctors thought could leave him disabled. That's a powerful story. So you're probably thinking, if these things are so great, what's the problem? Why is there this huge fight with regulators? Well, that brings us right to the heart of the conflict. It's really important to remember that peptide therapy itself is not new, not at all. The most famous peptide out there is insulin, and we've been using it for over 100 years. The whole controversy that's blowing up right now, it really kicked off in late 2023 when the FDA decided to restrict a whole bunch of these newer therapeutic peptides, making it hard for compounding pharmacies to produce them. So what's the official reason from the FDA? Well, their main concern boils down to this: insufficient safety data. They're basically saying that for a lot of these specific compounds, they just don't have enough recognized data to be sure they're safe for people to use. But here's the counterargument. The doctors and advocates in our source material say that reasoning is just unfair. They point to examples like one peptide, thymosin alpha-1, and say, hey, wait a minute, this has been studied in over 8,000 patients and was shown to be safe. So from their point of view, the data is out there. They believe the FDA is just choosing not to recognize it. And that leads to a really serious accusation you see in the source material, the idea of regulatory capture. The theory here is that the FDA might be too influenced by the very industry it's supposed to regulate, in this case, big pharmaceutical companies. The argument goes like this. You can't patent these peptides easily, so they're cheap. Big pharma sees them as competition, so they pressure the FDA to restrict them, clearing the way for their own expensive, patentable drugs. So, as you can see, this is why the whole debate gets so heated. It stops being a simple discussion about molecules and science and turns into something much bigger, a fight over medical freedom, patient choice, and a doctor's ability to prescribe what they think is best. And people are definitely pushing back. In response to the FDA's move, a grassroots movement has really taken off. There was this online petition to save peptides that had been sitting at around 1,600 signatures for years. Then, after the FDA's announcement, it exploded to over 4,000 signatures in just 1 week. That's a huge jump, and it really shows you how concerned people are. And here's one of the biggest arguments from the pro-peptide side, and it's actually about safety. They say that by banning access from trusted, regulated compounding pharmacies, you don't get rid of the demand. You just push people toward a dangerous, unregulated black market online. And when that happens, there's zero quality control, which could end up causing some really serious harm.
So it all boils down into this really fundamental question. When it comes to our health, who gets the final say? Is it the regulators, whose job is to ensure safety for everyone? Is it the doctors, who see the patients one-on-one? Or is it the patients themselves? You've got the argument for strict oversight on one hand, and on the other, the fear that that same oversight could be doing more harm than good. As always, we're just here to lay out the different sides of the story. The final call, well, that's the big question, isn't it?